Good afternoon. Welcome to the Utah Rural Health Association webinar, Working Together for Community Wellbeing. My name is Christina Mead, and I am a U.S. Public Health Service Officer and the Regional Pharmacy Consultant for Health Resources and Services Administration in the Denver Regional Office. As one of the agencies within the U.S. Department of Health and Human Services, HRSA is the primary federal agency responsible for improving health care for people who are geographically isolated, economically or medically vulnerable. HRSA programs help those in need of high-quality primary health care, people living with HIV/AIDS, pregnant women, and mothers. I am most honored to moderate today's panel discussion on working together for community well-being. We have an amazing panel of speakers representing various organizations serving communities across Utah. We are honored that you have joined us for today's discussion. First, allow me to outline a few community health and partnership models that will prepare us for our panel discussion today. Public Health 3.0 is a model that outlines how public health is what we do together as a society to ensure the conditions in which everyone can be healthy. Recent stressors on public health are driving many local governments to pioneer public health models in which community leaders serve as chief health strategists, partnering across multiple sectors and leveraging data and resources to address social, environmental, and economic conditions that affect health and health equity within any given community. Please refer to the CDC Preventing Chronic Disease Journal for references to Public Health 3.0. In addition, the United States Surgeon General has also prioritized community health and economic prosperity with primary focus on engaging businesses to be community change makers and forces for health in their communities, implementing solutions to help improve and sustain the health of communities, and strengthening communities to be places of opportunity for health and prosperity for all. And finally, as we face COVID-19 together, community partnerships and collaborations are more important than ever. Protect yourselves, your family, and your community by practicing behaviors that reduce your exposure to and transmission of COVID-19, such as following CDC guidelines, staying healthy by regular eating, sleeping, and exercise, practicing physical distance while staying socially connected to friends, family, and networks through technology. As a community-based organization, evaluate your role in community mitigation strategies as outlined by the CDC. The goals for using mitigation strategies in communities with local COVID-19 transmission are to slow the transmission of disease, and in particular to protect individuals at increased risk for severe illness, including the elderly and those with pre-existing health conditions, and protecting the healthcare and critical infrastructure workforce. Before we get started, I wanted to mention a few housekeeping items. First, we'd like to thank our sponsors for their generous support. And we'd like to thank those providers who are on the front lines, serving those affected by COVID-19. Today, we are using the Zoom video platform. You should be able to see and hear each of the panelists, as well as a number of buttons and features to change your screen view, utilize the chat box, and the Q&A buttons. This webinar will be recorded so that you will be able to view any portion that you missed. Each panelist will introduce themselves and provide a brief presentation about how their organizations have built successful partnerships in their communities. After the panelist presentations, I'll moderate a short discussion with all of the panelists. To wrap up the webinar today, we'll have a couple of minutes remaining for you to ask questions utilizing your Q&A function on Zoom. Our total time today is condensed. We only have 55 minutes, so we want to move fairly quickly to make sure we have time for your questions. Throughout the webinar, we invite all of you at any time to use the chat section to share what you're doing in your communities and any action items that you will do to enhance partnerships in your community. And finally, in order for you to obtain CME through the American Academy of Family Practitioners, take note of the instructions at the bottom of the sponsorship slide showing now. So let's get started. I'd like to invite our first panel speaker, Jordan Merrill, to begin our discussion. Jordan, I'll turn it over to you.
Thank you. hopefully my screen's showing appropriately up on the screen now.
I see it, Jordan.
Can you see the, okay. All right. So I'll introduce myself and a little bit about what I do. I work for community health for Intermountain Healthcare. And many of you know what community health is. Some of you may or may not. Also, as far as what Intermountain's goals and missions are, I know that my wife, she's worked for Intermountain Healthcare for about 15 years. And everything that we knew Intermountain as was very clinical minded and a lot of that, but there is a huge community piece that they are constantly involved in and trying to help build the community and better it and help people live the healthiest lives possible in every way possible. And that's kind of what my role is to be able to help people do that, help people receive access to services, maybe those that are financially unable to, or improve overall knowledge and benefits to the public to relieve government burdens. And so that's kind of what my role is and how I fit in there. The coalition that I wanted to kind of talk to you about today, I sit on a number of coalitions. The one that I'm here to talk about coalitions with, particularly because I've been involved with this one the longest, is our Healthy Dixie Council here. That they are a Washington County based coalition, that they serve all the communities throughout Washington County. They serve the rural communities. Luckily, I am from a very rural community of a little town. I grew up here in Washington County, but I grew up in Enterprise, and so I know kind of the services that they get and those that they don't get. And I currently live in St. George right now. And so we try to reach all the areas here in Washington County through our coalition efforts. And our goal is to bring healthy communities throughout Washington County throughout creating policy change and all well-being. It's not just physical health, nutritional health, mental health. We will take on anything that can help people be healthier in general. And part of our goal and our mission there is to really branch out and not just get key leaders of our community, but those that align with both their work and what our mission is. And so we have people, we have officials from the cities, the counties, the hospitals, a lot of local citizens are a part of our coalition. And these are people that we have really vetted out over a long period of time that can help build the community, not just maybe a singular focus on nutrition. This is a coalition where we've built and asked for people to participate by being involved, whether it's my role here in community health for the hospital is to really work and support overall community health and supporting their mission. Part of what we do is in community health is we do a community health needs assessment where we go out and work with our community partners to gather information that is most pertinent in every individual community. And that includes our rural communities out here in Washington County and surrounding areas. And so that needs assessment is part of what helps guide this coalition and guide some of the work here in Washington County. We also ask and invite others that have similar needs assessments throughout the city, the county, and actually there's multiple cities involved. So throughout in each individual city, we get them involved with bringing their needs assessments as well. And that's really where and how we determine what we will do as far as the focus that sets us up for the next year. Some of the things that we have tried and learned over the years. Healthy Dixie's been an existing coalition for over 15 years now, and some of the things that we have learned that if you get too broad with your coalition work, you want to change the world through your coalition, you're going to miss a lot of the marks. And so we've learned that less is more, and we've tried to really condense down what we try to do and how we do it. We've identified particular missions that are engaged in my work, and as well as everybody that sits at the table at our coalition in their work. There's not a person that sits at the table that doesn't have a role in our mission. And so we've identified some focus areas surrounding active transportation, school and adolescent focus, as well as the emotional behavioral support through physical activity of our county. And those are the areas. And so we've picked out different plans and different projects that we will work on. And we have learned that every individual matters to our organization, not just in the community, but everybody that's got a seat at the table. Their opinion is an important part of the work that we do and how we do it. And I bring it up in every coalition meeting that we've got now. As the president, I really talk about how I want people to be kind of self-absorbed as a coalition member. I want them to find the things that they're passionate about that align with our strategic plan and take that self-interest back to our coalition. So if somebody is, for example, interested in building and growing our local recreation plans throughout the county, we want them to bring that to our coalition to support those efforts. We want everybody that has a seat to have a voice, and that's been important, and it's been part of where we've had a lot of success over this last couple of years, is that everybody has had an important voice in that. We work on timely goals. We have a great big old strategic plan developed on a spreadsheet that everybody loves to look at. We glance at it. I track it, and we track the percentages that we accomplish these goals. We go over, take a 5-minute break to see where we're at on setting our goals, or accomplishing our goals rather. And then I mentioned that we do the tiered focus as well. These are just some of our accomplishments that we've worked on. I don't expect anybody to read all of those. Those are just things that we've worked on over the last 2 years, and they all surround these 3-tiered focus that we do. Just some of the pictures from some of our activities. We've developed programs within the school district, and we've had members of our school board we do have members of our school board on our coalition that help us overcome barriers and accomplish a lot of things within our focus area of the children and adolescents, especially, to accomplish better health and better well-being. Some of our more fun activities that we've developed, some biking programs within the school that they have not previously had, and tried to make a lot more schools bike friendly. And so with that focus area, we've engaged every single one of our partners to be involved in that, whether it's through a donation or through time or through effort, and then start creating policy within our school district. And now these programs kind of run on their own. And that's really what our goal is to engage everybody in getting involved in that. That's the main focus of what I had to talk about. So on to the next. Thanks, Christina.
Thank you, Jordan. I'm excited for our question and answer section. Yeah. But at this time, I'd like to invite Teresa Willie. Teresa, go ahead.
Hey, let's see if I can get to my PowerPoint. Okay. Here we go. Oh, whoops. Can you guys see my slides? I don't know if I see what you see.
I can see Pam. Oh, there we go.
There we go. Okay.
I see your map.
Okay. Okay. So I was asked to speak about mental health coalitions throughout the state. I'm Teresa Willie, and I work for Southwest Behavioral Health Center, which is the local authority for substance abuse and mental health. And we oversee the 5-county area in southern Utah. I have been a prevention specialist for about 21 years, and my current role is to coordinate the Suicide Prevention Coalition in Washington County. So one of the things that I thought would be interesting is I found out how many coalitions are specifically focusing on suicide prevention in the state, and we have roughly 20 coalitions across the state that are working in the suicide prevention arena. The value of that is that coalitions work together using evidence-based models such as the community care model or the strategic prevention framework, or some of us use a combination of both. This allows us to effectively implement evidence-based strategies and programs that meet the needs of our individual communities. So as we work together, as state coalitions, we're able to share resources, data, knowledge, and information, which can be really helpful. So the Utah Suicide Prevention Coalition actively serves all of the coalitions surrounding the state by providing oversight, networking opportunities, training, and technical support. And other community partners can help us to support coalitions in a number of different ways. And I just listed some of the partners throughout the state that can help support your coalition in their suicide prevention efforts. And I'm not going to specifically go through those, but in Washington County, Jordan sits on my coalition, and they offer resources to us as well. So Intermountain's been a really great partner for us, and I know that they partner with coalitions throughout the state as well. But all of these different agencies can offer healthy things and help you magnify the efforts that you're making throughout your different counties. So talking about some of I polled some of my friends throughout the state and asked them what their coalitions are doing to promote suicide prevention and some of the strategies that they're using. And these are the things that they shared with me. Working Minds, which is designed to be a suicide prevention strategy in the workplace, where the human resource director can, for one, create a healthy environment so that people that are maybe struggling with mental health issues are safe in talking about the needs that they have, or just specifically creating that environment so that people feel safe in that as well, but also doing suicide prevention training. We have a heavy social media presence, I think, with our suicide coalitions throughout the state. And I like that we're able not only to work with the state's social media, but also with our local areas as well. We have radio ads and theater ads that we play in our local area, and specifically the Is Your Safety On with the firearms safety, because we know that firearms are the most commonly used method for suicide in our community. We also have Hope Squads in every one of our secondary schools in Washington County. About 15 years ago, someone asked me to create a Hope Squad at the high school where my kids went to school, and so we did that. And for about 10 years, we had one Hope Squad in our community, and now we're happy to be able to support 17 squads in the Washington County area. So we also have Hope for Tomorrow in some of our local high schools, where students are able to come in during lunchtime and listen to mental health forums to learn some life skills that might help them do better in their lives. And then the Safe Talk training, one of the people I think it was in Richfield, said that they did a Safe Talk training, and in an effort to get more people there and to normalize the conversation of suicide, they had a concert following that training. So the community was invited to attend the concert. in Washington County, we've created comfort bags for attempt survivors, and Intermountain helped fund these, and then these bags will go back to attempt survivors that visit the emergency department or the access center. But inside those comfort bags, we have blankets, squeeze toys, little coloring pages, things that can help someone de-escalate if they're feeling stressed, but it also has a lot of pertinent information for critical resources within the county. Intermountain's also working with See Your Strength to do a hope wall in the hallways for the pediatric unit there for kids that come in that might be struggling. And then we do free QPR instruction throughout the county. We did about, I'm trying to think of how many, I just did the report and I don't remember, but we train nearly 1,000 gatekeepers in Washington County every single year, and I'm really happy about that. Nearly 30 trainings or more. And then we've, one of the areas, I think Kanab, created some mental health kits for their medical providers so that they are able to implement the CALMS questions for people when they come in, talk to them about mental health and suicide ideation. And then I think a lot of the areas do community mental health fairs, providing information for family members. So these strategies and programs would not be possible without our community partners. I think we can never, ever overstate the value in working with community partners and helping create the ability for us to accomplish the things that we're doing. One of the things that I've realized is that some of the coalitions throughout the state focus exclusively on suicide prevention, and then some focus on substance abuse prevention and suicide prevention within the same coalition. And in Washington County, we have a coalition focusing on each of those separately. But what we've learned is that protective factors are protective factors. Prevention is prevention is prevention, to quote Vern Larson, one of my favorite prevention mentors. But if we focus far enough upstream and start working on those upstream prevention efforts, what we realize is that many of the risk factors for substance abuse and for suicide are shared risk factors. And so we can work in tandem with coalitions. If we're separated in our counties, we can work together to combine resources to achieve those shared outcomes. And an example of that would be our prescription take-back day. When we do a prescription take-back day, not only does that address the risk factor of people misusing or using medications that are left over, but it also addresses the risk factor for suicide because we're taking away that access to lethal means. So these are some of the things that we do that get us upstream in our prevention efforts. Family bonding events, promoting family bonding time that addresses all of those shared risk factors. Guiding Good Choices is the parenting program that we do in our county, as well as strengthening families. And then Botman Life Skills for young people can address all of those shared risk factors as well. So that's just kind of a little overview of the things that we're doing in Washington County. I guess the main focus I want to leave you with is that we don't have to recreate the wheel. The overlap that we have with our community partners is huge, and they have so many things to offer. The state has so many things to offer. If you are working in the suicide prevention field, being in touch with the Utah Suicide Prevention Coalition can provide you with an unlimited amount of resources by way of data, strategies, resources, all of those kinds of things. So we're all in this working together, and we want to make sure that we are doing our best with public funds to save time, resources, and funding.
Thank you so much, Teresa. That was wonderful. And with that, I'd like to invite Sarah Hodson. Sarah, go ahead.
Okay. Just getting my slides up here. Can you see that?
I can.
We're good. Okay. All right. Thank you. So I'm Sarah Hodson. I'm the Executive Director of Get Healthy Utah, and we are really proud to be a sponsor of this event today. And it's been exciting to participate throughout the day and have the opportunity to learn and engage in this virtual format. And I just want to congratulate Locke and his team for pulling this off. I know that that was a lot of stress and work to get this event to come together, but I think it is shows the flexibility of being able to do something like this. So I'll tell you a little bit about Get Healthy Utah and some of the coalition work that we're doing. Our mission is to create a culture of health through engaging multi-sector stakeholders, building partnerships, providing resources, and connecting efforts that support healthy eating and active living. And really central to our mission is the belief that in order to address complex behaviors like healthy eating and active living, it takes partnership and collaboration, that really no one organization or agency could solve complex problems such as healthy eating, active living, diabetes, obesity, chronic disease, all of those things. And so it really takes all of us working together to try and improve those health outcomes. And our work is mostly done around three sectors: schools, workplaces, and communities. And in those areas, we're looking at the policy, system, and environmental type changes that can improve the culture of health, and also trying to be aware of opportunities that are equitable for all people in the population so that we can have improved health and wellness for everyone. And I'm sure many of you are familiar with some version of this: where we live, work, and play impacts our health and well-being. And this is around the idea of social determinants of health, which I think has been kind of talked about a little bit by the other panelists as well. But these are the conditions like our socioeconomic status, education, income, our access to healthcare, those types of things that impact our health. And that really helps us provide a framework for what types of partnerships and collaborations are most beneficial for us to participate in and will be most advantageous to kind of moving our mission forward. So for example, if we're thinking about improving physical activity, then we're thinking about, well, what happens in the community that improves physical activity? Are there safe places for people to walk and bike? Are there recreational opportunities within the community? What happens within the school? Is there a good recess policy that allows kids to get out during the day and be active? Is there PE available at the school? Are there safe routes to walking and biking to school? What happens in the workplace and policies in the workplace that might affect physical activity, and what's happening in the faith-based community that might support that activity as well? So thinking of all of these areas, and that helps us to be involved with the partnerships and coalitions that are going to have the most impact. So I wanted to talk just about two of the coalitions that we're involved with. And like I mentioned, we sit on a number of coalitions, but I wanted to focus on one related to physical activity, this first one, and then the second around healthy eating. And when you think about who should we work with to improve physical activity, the Department of Transportation is probably not your first pick of who your partner is going to be. And I will say that when we started our work in 2015, we were really looking at a lot of maybe the usual suspects and partners, the healthcare systems, public health agencies, other health nonprofits, those people who are working to improve physical activity. But what we've found over the past couple of years is that transportation agencies have really been a strong and key partner in improving physical activity through active transportation. So a little background about our relationship with the Utah Department of Transportation. In 2018, in the legislative session, lawmakers passed a comprehensive transportation bill, Senate Bill 136, and that bill addressed funding mechanisms and transportation oversight and long-term planning. And it directed the Department of Transportation to develop strategic initiatives across all modes of transportation. And it also modified the way that they do their prioritization modeling. And so as a result of that, they came up with this, what they call quality of life vision, Utah's transportation vision, and looking at quality of life. And they have these 4 outcomes that they're most concerned with. One is good health, better mobility, strong economy, and connected communities. And again, just taking a step back and thinking that the Department of Transportation is thinking about how do the decisions they make impact health, I think is really interesting and significant for us. And in the category of good health, they're thinking about the role of active transportation in physical health and mental health, and then also the impact of air quality on transportation decisions. Better mobility is looking at public transit and walking and biking and reducing traffic congestion. Strong economy is looking at the role that transportation agencies play on the economy. And then connected communities is looking at the intersection of transportation and land use. Are people able to get to the things they need, if it's medical care or if it's access to healthy food or other services that they might need? And so what's the role there of transportation, vehicle, biking, and walking? And so as part of this legislation, the Department of Transportation brought together a stakeholder group that I participated in, and we talked about these 4 outcomes and what strategies might be important in each of the 4. And while this is relatively new, it just started last year, I think in the future, this is going to have a big impact on the accessibility of people to be physically active. So it will improve walking and biking in communities, and it will improve the focus of the Department of Transportation on things that they're prioritizing. The new prioritization model, for example, takes physical inactivity into account when they're giving prioritizing projects. So if the community has a project that they are trying to get funding for that improves walking and biking in a particular area, and that area has a low level of physical activity, that can get them more points in the model that they're using. So I think that's really a good step forward for Utahns having access to physical activity. And then the second coalition that I wanted to just highlight is one around healthy eating. And this is from a grant we received from the United Fresh Start Foundation that we applied for at the end of last year. There were 230 applicants, and we were one of 6 recipients nationwide for this funding. And this is a project that we are collaborating with the Beaver Valley Hospital. Scott Langford at Beaver Valley is on my board of directors, and we had been talking about different ways that we might be able to work together. And when we saw this grant, we thought this was a perfect opportunity. So the purpose of the grant is to improve fruit and vegetable consumption in children outside of the school day. So it can't be part of the school breakfast or lunch program, but things that happen outside of the school day. And so Scott helped pull a coalition together that includes the USU Extension in Beaver County and Mike's Food Town, which is a local grocery store in Beaver. And we met in February, our coalition started, and we met in February and talked about how we were going to get increase fruit and vegetable consumption in children. And so the strategies that we came up with were that once a month, we would have a bag of fruits and vegetables. On the picture on the right, you can see what was in the bag in March. It contained apples, cucumbers, grapes, carrots, and tricolor peppers. And so it's $5 worth of fruits and vegetables that's paid for by the grant. And we had 50 bags put together. And then the bag also included a $5 voucher for fruits and vegetables so that the family could go back to the grocery store and get $5 additional in fruit and vegetable. And that was also paid for by the grant. And in addition to that, USU Extension put up those healthy choice, that middle picture there, the thumbs up healthy choice in the grocery store to indicate which items were healthy choices. And they also strategically put them on sale items so that families could have the biggest bang for their buck. So these bags were distributed in March. And then the following day at the grocery store, there was a taste testing using the peppers, and they made whole wheat quesadillas with peppers. And so that the people could try the peppers that they also got in their bags. And then the recipes were handed out at the taste testing. So it was a really, really great event. The plan was to do that monthly. Of course, everything is on hold now that schools are out and we're all social distancing, but we hope to be able to start this back up in the fall and then again be able to provide the vegetable bags and vouchers to the families in Beaver. So that's an exciting project. This is just my contact information and our social media accounts that you are welcome to follow. And I'm looking forward to the Q&A and to be able to answer any questions that you might have.
Thank you so much, Sarah, Teresa, and Jordan. You know, as I listened to each of your presentations, I think what struck me were some themes that were consistent across all 3 of you, and that is prevention, prevention, prevention. Your mission-driven and strategic approach to and organizing what you do in your communities. And then also, and importantly, you all verbalized some level of coordination and alignment with efforts from other community partners. So I really heard a lot of discussion around how one strategy you may have overlaps with another in the community, and then how you kind of align and coordinate those intersecting topics to serve your communities and maximize your resources. Thank you so much. Well, we're going to take the next 20 minutes to have a moderated session with our panelists with some specific questions. But for those of you on the webinar, I urge you, as you're thinking about questions you may have for specific panelists, please use your Q&A button at the bottom of the screen to ask your questions, and or your chat function to make comments about what you're doing. So let's go ahead and get started. For the panelists, the first question is, how do you engage new or non-traditional stakeholders for your coalition? And what I thought I would do is, Sarah, I thought we'd start with you, followed by Teresa, and then Jordan for this particular question.
Great, sure. So as I mentioned before, we work on a number of coalitions, and some are ones that we bring together, sort of serving as the backbone organization, and others that we are participating in that other people have arranged. And you know, we've been thinking a lot recently about upstream. I think Teresa mentioned upstream as well. You know, how are the ways that we kind of approach these problems from an upstream approach? And that requires, I think, non-traditional partners if you're doing that. You know, in our case, if we're thinking about physical activity and healthy eating, that might mean we are partnering with transportation, like I mentioned before, or housing, education. So these are, you know, partners that maybe in the past we wouldn't have thought of in the same way, but now if we're thinking in upstream terms, we need to be thinking about who are the people that are already doing that work and have those connections, and then trying to reach out to them. And one of the things that I think is really important with non-traditional partners is helping to make sure that they understand the role that they play in health. So in our case, again, it's trying to make a non-traditional partner understand that they do impact health, that the decisions made in educational settings impact health, and around income and around housing, and that we really are all working on the same things when we get down to those root causes, and helping people to understand that. And I think that helps bring those partners in. And then the other thing I would say is that finding ways that you can have a mutually beneficial partnership, so that we're not asking people to do extra work necessarily. We're just asking maybe to approach the work differently, or find the places that we can collaborate and that we can be mutually beneficial to each other, so that we're not adding any work or burden to anyone.
I love what Sarah said. Thank you, Sarah. And just to play off that, those are some of the things that we're doing as well. I think it's really helpful in the arena that we work in, and all of our existing coalition members work in, to just go out and have conversations with people about what we're doing and what our goals and objectives are. And we've been able to recruit coalition members based on that. We encourage our coalition members to reach out to other potential partners that might have a vested interest in the goals that we're trying to accomplish with our suicide prevention coalition. So for example, just having conversations, one of our coalition members reached out to someone else that works in the treatment field. And you might think that treatment and prevention aren't very related, but of course we're all on the same continuum. We're all working for those same goals. And so being able to bring in some of our private business treatment partners has helped us fund some of the projects that we're doing. And just being willing to walk in and have a conversation, not being intimidated by that. One of our non-traditional partners is the owner of a gun shop in our community. And for suicide prevention, that's incredibly powerful, because they help reduce the stigma of talking about how firearms relate to suicide. And so just being willing to get out there and knock on a few doors, and oftentimes it's not what we say so much, but the way that we say it that can open those doors and engage other people.
I'm just going to springboard off of both what Sarah and Teresa said. It's wonderful. I also think along those lines, in looking for non-traditional partners, there's so many people that are willing out in the communities, in every community that we find, to align with both what our coalition's goals are, but to better and to help. There's so many people, and a matter of finding those is some of the ways that have been mentioned, and also thinking outside the box for some of our active transportation stuff. It's not just the policymakers. We've involved engineers and some of the local city engineers and planners on our coalition to help us think about what they're dealing with to once we get to the higher level, the upper level stuff. And so it's a matter of just picking those out, and it's not always that we have to go and we're not desperate usually, because there's so many people that are willing to help. It's just a matter of finding the right people that can help for what your specific cause is. And then once they're engaged, then they're engaged, and it makes all the difference for them in their job and their work and the satisfaction that they feel, as well as what we're trying to do and accomplish as a coalition.
Thank you, everyone. I was just reacting to what I was hearing. And again, I think the common theme that I heard was really building relationships and having conversations with people across different sectors to kind of help identify those areas where, in fact, you are aligned, even if you have very different roles and responsibilities in the community. I love that. Thank you. For the second question, how does your coalition define or measure successes, outcomes, and/or objectives? And I think for this question, Teresa, I think I'd like to start with you, followed by Jordan and then Sarah.
Okay. All right. So some of the ways that we follow, I talked about following evidence-based models with our coalition efforts. So we have to look at the logic models that we create from that. And then we look at qualitative data, so the things that we can measure. How many people did we reach? Did we reach the right demographic? How many people actually participated in the programs that we're running? And then, of course, the qualitative data that shows up in pre and post tests or satisfaction surveys. Those would be short-term outcomes that we would measure. Our long-term outcomes, of course, are going to come a lot further down the road, 5 to 10 years. And those things we would be looking at some of the community data that we have available to us in the community. So our SHARP survey, which is our student health and risk prevention survey, is one of the most valuable resources that we have for data that help us measure whether or not we're reaching our goals. We look at emergency department data, and we look at data from the Utah Health Examiner's or State Examiner's Office, Medical Examiner's Office, and then also the health department data in their violence injury data in the IBIS is very, very helpful in helping us measure whether or not we're meeting our long-term goals. So short-term goals and long-term goals, that's basically what we do, is follow those evidence-based models and then look at the data.
Some of the things that we do, some of them are very similar to what Teresa does, but we are, in our coalition, we work a little bit more in some of the immediate tracking. We work a lot with our school districts in some of their tracking. One of our focuses is helping kids that might suffer from ADHD and getting them some physical activity to address some of that. And so our focus is for tracking that is just through the test scores and through the behavior issues that happen at the school, which the schools that we've partnered with will provide that specific data as well. And then along with what Teresa said, just in our tracking, we try to keep track of numbers impacted as well as policies that have gone into place. Those are some of the short-term things, and then the long-term is just in hopes. Some of these things that we've done with our coalition are new, and we're hoping there'll be a long-term goal, but we'll continue to track those as they fall on our strategic plan, and we check in on those every month. There's not a month that goes by that we're not looking at the data and we're not checking in with it. I think that's an important piece, is to always be looking at the tracking measures, the data. Otherwise, you kind of lose sight of what you're doing really quickly. And so that's one thing that we make sure that we do each month in our meeting as a group, and then individually as we are assigned those tracking measures.
Yeah, I'll just add a little to that. So it really depends on the coalition and the overall goals, and also who's funding it. So for our United Fresh Start Foundation project that I mentioned with the fruit and vegetable bags and vouchers, we have obviously specific things we have to report back to them in terms of the number of bags we gave out and the number of vouchers, the number of children that attend the taste testings, that sort of thing. So those are things that we are going to track pretty closely and have to report back for the grant. But for some other coalitions, and particularly if it's not grant funded, maybe it's a little bit looser in terms of how we are tracking the success. And sometimes it's simply, if we meet together and we're building this relationship in the beginning, that's a success, to be able to say, yes, we could come together, we could find a common goal that we're working on, and we could plan to meet again in a few months. I mean, sometimes in the beginning, that's about all you can hope for. And then, of course, down the road, you want to have things that you're tracking and that are being measurable. Another example, we're part of a United Way coalition that's also doing some fruit and vegetable consumption in school, a separate project in the Salt Lake area. And United Way is very good at not just tracking the outcomes of the particular projects that we're working on, but also trying to measure the success of the coalition itself. So for those meetings, we take detailed tracking of how many people attend, how many people offer to do an action item at the end of the meeting, how many people followed up on the things that they said they would do, all of that. And that's a great reminder that sometimes it's a very simple, casual, are we meeting? Yes, great. And other times, we want to be a little bit more formalized and say, are we having, is the meeting itself a success, and are people contributing and attending in a way that makes it beneficial for everyone? Because nobody wants to go to more meetings than they have to. We all know that. But finding the right mix of those things and in terms of what type of coalition it is, I think is important.
Thank you, everyone. And again, what I heard was the importance of measures and data sets to support and populate those measures, and your partners having data sets on their own, and a level of alignment to make sure that all partners involved are able to measure their own successes potentially within the coalition and then within their own organizations. Thank you, everybody. The last question: how does your coalition identify community needs? And I think what I'll do is start with Jordan, and followed by Sarah, and then Teresa for this one.
That's an easy one. That's one of the ones where it aligns with what I do for Intermountain in our community health needs assessment. We base a lot of what we do as a coalition off of that particular needs assessment. And so we go through those, and then that's when we start breaking down the populations that we determine that we can make an impact or change policy with, and who we have at our table. So we use the community health needs assessment that Intermountain does, that we have a 5-county association of governments here that they do a community health needs assessment as well. They usually align pretty well along with all of our organizations here. And so we take that data, and that's really what determines what we do. We see that what's the greatest need, and that's where even our coalition this year brought in a little bit of mental health without overstepping some of the great work that Teresa does, and we are trying to impact in the school specific, and so just in a different way. But we use that data from the polled community health needs assessments that each organization does.
I'll just give the example from our the project that we're doing in Beaver. So when we saw the opportunity to apply for that grant, we had to provide some proof of community need. And of course, we have access to BRFSS data through State Health Department, and we can get demographic data. So we can find all of that, which is really beneficial and helpful. But I think even more important was having the Scott Langford from Beaver Valley Hospital be able to kind of give us a sense of what is the feel on the ground, what does he see as the hospital administrator, what's happening, through the USU Extension contacts there. So it's kind of a mix of course, using the data to determine the direction of where you're going and also to identify that need, but also supplementing that with the on-the-ground community member insight that they can provide into what's happening and kind of tell the stories of the community. And I know that's true too when we do work here in the Salt Lake area, that it's really essential that you have community members participating and not just outside organizations coming in, with our ideas of what should happen in that community. So being able to use the data and then have that supported by the community voices that are important as well.
Perfect. And I know that we all use a lot of data, and we do that as well. I talked about that a little bit in how we define our outcomes. But so we would obviously look at that to drive future efforts. But we also do what we call a community readiness assessment every 2 to 4 years. And that is an evidence-based assessment from the Triethnic Center for Prevention Research out of Colorado State University. And by using that assessment with fidelity, we can find out where on that 1 through 9 Likert scale we are as a community and how ready we are to actually receive prevention services. And so the last community assessment that we did, we found that we're only at about a 3 to receive suicide prevention services. And then as we look at that, they have suggestions for strategies, maybe not suggestions, but services specifically designed to address whatever level of need that our community is in. So for example, right now our goal is to get the information out and let people know what kind of things we're doing through radio and television and just public information. And so that's one of the things that we're also doing in addition to using our data.
Thank you, Teresa. And what I heard from you all is it sounds like there are a few options for either using tools to identify needs, and that can be from where to start to where to go next, and then direct community input for identifying where those areas of need are. Thank you so much. At this time, I'd like to invite anyone listening with us today to ask your questions in the question and answer section. I don't, as of yet, have any questions, but I do see in the chat box from Lisa Hendrickson. She makes a comment, and it's making me think of another question. But Lisa says, just a thought about how this format saved us all from drive time and money, and maybe a way to get more people tapped into coalitions. I really like that comment, Lisa. And again, kudos to Locke and his staff at the Rural Health Association of Utah. They pulled this off very quickly in lieu of a pretty serious situation that we're all facing right now. But my question, actually, Lisa's comment makes me think about a question. I asked all of the panelists, how do you engage new members and organizations? And I'm just thinking about another question for you all, and that is, how would new partners engage you? Potentially.
I'll start with that, if that's fine. I think that's a great question, because one of the things, we're very small. We just have two staff and an intern, and then a really great board of directors. But so our time is limited and our capacity is limited, and we belong to a number of coalitions. And we've talked about, if we get asked to join a coalition or a group or be a partner on something, how do you make the decision as to whether or not that's something that's valuable and worth our time? We actually have a little a decision-making model that we use. Does it align with the mission? Do we have the capacity to do it? Would we be a good partner for them? Would they be a good partner for us? That sort of thing, kind of just a quick yes, no. And that just came out of the necessity of limited capacity and wanting to make sure we're spending our time and resources in the best way possible.
I love what Sarah said about being able to serve people back and picking and choosing. You know, you have to prioritize because we all have limited amounts of funding and resources. But I think when we get the right people at the table, there's always going to be that what's in it for them when we engage community partners. And so if they feel like the coalition is serving their goals and objectives in their individual areas, then they're going to be able to, we're going to naturally be able to serve their needs just by what the coalition's doing already. And that's kind of the magic of coalition work, is that we're all working together on the same things and filling everyone's goals and objectives while we're working together.
I go with usually who has the best lunches. That's usually my safe zone right there. No, I'm just kidding. I really I agree with what's been said, and any level of engagement that I would have, it needs to align with what my interests are, both professionally and personally. And so my engagement would come fully through both good lunches and from just making sure it aligns with what I'm doing currently. Because if it's outside of that, I probably won't have the bandwidth to do it.
Thank you so much. I'd like to be respectful of everyone's time, and I just am so honored to have moderated this panel today and to have been part of listening to how so many organizations across the state are enhancing the health and well-being of the communities that they're serving. I really appreciate that opportunity. And with that, Locke, I'd like to turn it back over to you.
Thank you very much. This has been great to listen to this. I'm a coalition fan for sure. In fact, Jordan, brings me back to about 10 years ago with Healthy Dixie, as we were meeting around for lunch. We kind of met each month and really didn't have a lot of direction. And then we got a grant from the Achieve grant. And I can't remember who it was from, whether it was from HRSA or from the CDC or where it was from, but it's a little money that gave us some training on how to organize coalitions and be effective. And it's great to see 10, 15 years later that coalition is still moving forward. It's really exciting. And I just want to thank all of you for participating, Christina, for you moderating, Teresa for mental well-being. We've had some earlier discussions with that and suicide prevention, and for attendees that are on that have joined for some other meetings. We've been just very successful in being able to communicate these things out to our rural communities. And lastly, I'll just say that I think this is a format that we can help touch more rural areas, and we're learning some things. We're making lemonade out of lemons from being able to stretch ourselves in this way. And certainly my children will tell you I'm the least media-oriented guy there is. And I just want to thank all those that were behind the scenes making this happen. But thank you all for your time and for your coalition work to help promote health and wellness in our communities. Thank you.
Thank you.
Thank you.
Thank you all. Appreciate you.
You have their contact information here being screened, and it is being recorded, and we'll be sharing these further out on social media. So don't be surprised when you're being seen out there in other ways.